And the pandemic really, it hit everyone hard. It was a global pandemic. We're not alone in facing those challenges. I think, and Anne's obviously been a huge kind of figure in this, but we want a scaled up investment into joint and family support. I think we had called for 1.2 billion for this spending review period in total.
At Baby Zone, we see the impact of early years policy not in statistics, but in people. In the parent who can't get a health visitor appointment, in the 2-year-old that's never had a developmental check, in the family referred to 5 different services that don't talk to each other. We see what happens when the system works, and we see far too often what happens when it doesn't. My guest today represents the think tank that's arguably doing more than anyone right now to hold the government to account on children's outcomes and to build the evidence for what works. The Centre for Young Lives was founded by Baroness Anne Longfield, the former Children's Commissioner for England, and in just over a year, it's become one of the most influential voices in UK children's policy. Its research has directly shaped the government's Young Futures programme, its school readiness targets, and the rollout of Best Start family hubs. Its State of the Nation report exposed the scale of childhood vulnerability. 4.5 million children in poverty, mental health problems doubled since 2017, A&E visits among under 5s up 40% in a decade. Anna Heuschkel is the Centre's policy researcher and early years lead, and one of the lead authors of the landmark Best Start report, which shows that joined up family support now receives less than a quarter of the funding it received at the peak of Sure Start. This is a conversation about what the evidence says, what children need, and what stands between them and getting it. Anna, welcome to Best Beginnings.
Thank you
for joining me.
Thank you very much for having me. It's a great introduction.
So, as I said, the Centre for Young Lives has been going for just over 2 years, and it's already shaping government policy in a great way. And obviously your kind of research and your model has become the basis for some of the government's policy agenda, based on Young Futures and school readiness. For people that don't already know the Centre, what are you trying to do, and why did Anne feel the need for it to exist?
Yeah, so the Centre for Young Lives came off the back of the Commission on Young Lives, which was a year-long commission that was from 2019 to 2020, which looked at how you create systems that really prevent crisis happening in young people. So there are a series of thematic reports, including mental health, young people involved in the criminal justice system, and how you create, national policy, but also local systems that prevent that escalation from happening. And so from there, that has sort of directed a lot of the work that we do at Centre. So we cover quite a broad range of policy for children and young people aged 0 to 25, so the full age range, which is obviously quite broad. So things like play, we had a play commission that launched its final report last year, which called for a national play strategy, among other things, but then from everything to inclusive education, mental health. But throughout, there's a sort of a golden thread throughout our work, which really focuses on not just, obviously we want every young person to thrive, but particularly a focus on those children and young people who face additional barriers to, reaching their full potential, achieving, thriving throughout life. So, children from lower socioeconomic backgrounds, children from certain ethnic minority backgrounds, but then also children with SEND, adverse, childhood experiences. That is a really particular focus that we try and, close some of those gaps that might be there in terms of outcomes between those children.
Fascinating and really important work. And your State of the Nation report painted a really stark picture. 4.5 million children in poverty, 160,000 in temporary accommodation, mental health problems, as you mentioned, A&E visits going up, and the pandemic also casting a long shadow. When you look at that picture, what's your honest read for how we're doing as a country?
It's not great. I think any number of children who are facing those vulnerabilities is not great. Obviously, we want in an ideal world every child and young person to have a safe upbringing, to be able to access full potential. And the pandemic really, it hit everyone hard. It was a global pandemic. We're not alone in facing those challenges. I think. And Anne's obviously been a huge kind of figure in this, but the government response to the pandemic was, children were really left out of that. They were an afterthought, the schools being closed while bars are opening, and we're starting to see the impact of that. I think this government, in all honesty, has got there feels like there's a step change in especially being a children and young persons think tank, we feel like there is, a desire, sort of a momentum around this sort of area and shifting the narrative to early intervention, prevention, and inherently that has a focus on children and young people that's really welcome. So there's a long way to go, but I think we are starting to sort of turn into the right direction.
Yeah, I heard Minister Bailey actually talking at the Nesta offices last week and thinking about the ambition that the government has, and I agree with you. It's laudable in terms of what they're aspiring to achieve in a relatively short time frame, and thinking about that pledge to get 75% of children up to a good level of development by 2028. We're obviously currently only at around 68%, and your analysis shows that we're only growing at sort of 1 percentage point a year. So I'm trying to think about my maths. It feels like it might not be reachable. So, what does the current gap mean for families? And I guess what are you suggesting or pointing the government towards doing in order to close that gap further?
So I think, as you said, the target is really welcome. I think targets like that, they align thinking, they align efforts at a national and a local scale. So really, really welcome. But yeah, as you said, it is a short-term target. And for lots of local authorities that we've been talking to who have been set their own targets, it's a big jump. I think from what the way we're viewing it, I think the way that the Department for Education is trying to sort of set it out is it's about setting that high ambition, but it's a longer term. Well, we hope it to be a longer term goal. And so what we're doing in some of our work around the school readiness target is thinking about how we can take this moment of momentum that's been created by this school readiness target and a sort of focus from government, and how we can use that momentum to maximise the target and really transform for the longer term the early years system. So not just thinking about these children who'll be turning 5 in 2028, but thinking about the children that will be turning 5 in 10 years and then 20 years, and how you can use this moment of focus in the early years to make long term transformation to the support that children and families have.
Yeah, and that's what we're really excited about at Baby Zone, because obviously it feels like the right time for us to be scaling and growing as well, and our reach across different families from target communities. I think I completely agree that there is a great conversation happening right now, and it's exciting to see where that's going to go. I guess you've also called for more data points, the child vulnerability dashboard and various other sort of points of data across different local authorities. Because I guess, while that 75% target is helpful, I think it's actually at a much more localised level, what you were describing with different local authorities as well. What do you think we're not currently seeing in the data that is helpful, or what would you like to see more of?
I think it's interesting. I think overall it's a great measure. I think it does sort of hide maybe some of the nuances that local authorities are facing in terms of their demographics, but also we know that for children with SEND and complex need, some of them are never going to reach that good level of development. So the question, I think, is, do we think about what else can measure their outcomes and, the challenge that they face that isn't a good level of development? And again, for, children with English as an additional language. But also I think, and this, it is captured in the data, some of the gaps between the different groups I think is really important. And government has set that additional target of also increasing the number of children eligible for free school meals in line with the overall improvement in good level of development. But I think what would have been welcome is to see them really aiming to close that gap, and so target some of that support to children who, from lower socioeconomic backgrounds, I think would have been welcome. But that is obviously captured in the data, and it would be something interesting to follow, because we saw that over the last 2 years, that gap between children eligible for free school meals and children who aren't, that did widen, and is a quite concerning trend in terms of, closing that gap would be.
And I also read your fascinating report about the Child of the North and that research, and around how there are regional disparities in some of this too. And then, as a dad, I've got 3 kids under the age of 5, 2 boys and a girl. And it was interesting kind of looking at the difference between boys and girls, as well as the free school meals, and children who are on sort of EHCPs too. So there's some really big divergences in these different groups. What do you think is driving them? What do you think is making these challenges as systemic as they obviously are?
Yeah, I think, when you take something like a child eligible for a free school meal, what that might not say on the surface is, we know that disadvantage is baked in from the earliest possible moment, and so with that comes several additional barriers that a child will face, and the circumstances of the family, which hold them back at each step. And so without that targeted intervention, and I think especially with this target, while it's welcome, what it risks is local authorities focusing on those children who are really close to meeting that target, maybe have one area of learning, whereas it disincentivises some of that longer term work that needs to be done to support those children who are facing multiple barriers or who are much further away from reaching a good level of development. And I think it takes a lot more work, a lot more funding, a lot more long-term planning to address some of those inequalities. And with this target and sort of the nature of short-term funding and political cycle, that can often be overlooked, and I think to the detriment of some of those groups who would benefit from longer-term support.
Absolutely, and that's something that we think long and hard about, is how to reach those who are, by definition, the most vulnerable, that need the most support, but also because of that are the hardest to get to sometimes and the hardest to find. So how do you think the government could augment, or what other sort of activities, services should we be thinking about, not just for those that might be on the cusp of that 75% definition for good level, but further away, what other interventions do we need to be doing in a more kind of joined up way? Yeah,
I mean, I will bang the drum of family hubs till the end of time, whether it's the nature of having worked with Anne and her experience working with the rollout of Sure Start. But I think services like joined up family support, so children's centres, family hubs, I mean, they're obviously universal elements, but also they can act as sort of an anchor in a community. And I think the part about, the point you make about reaching families and reaching those families who might be facing additional barriers, we need to be taking the support, and that's something that the Minister has been saying, we need to be taking the support to where children are. They may not be turning up at the doors of services, at the doors of family hubs. So I think whatever intervention, there's so much evidence on what interventions work and what don't. That's personally not my area of expertise, but in terms of delivering the interventions, it's important that families who need it are accessing them, and I think that should be the next focus point for government and local areas as they roll out these Best Start family hubs, Best Start local plans. They need to make sure that the services they do have are reaching the families that are most in need of that support. And I think there are some great recommendations of things like community navigator roles, or using the sort of voluntary sector. There's so many great voluntary sector organisations out there delivering support for young children. Work with those, work with the local services that you have, with the schools. Essentially, join up the system of support for young children to close some of those gaps that some children unfortunately are falling through at the minute.
Yeah, absolutely. It's building that coalition, isn't it, of local partners, local voluntary organisations and the government and statutory bodies under one roof. And that's obviously, again, what we're trying to emulate across our 8 hubs that are currently open, but obviously further across the UK as we continue to grow. I'd love to talk more about the example you shared just now on Sure Start. We know that Sure Start worked. The IFS evidence showed that it did multiple things, reducing hospitalisations, improving GCSE outcomes, and had its strongest impact on the most disadvantaged. And your own report found it decreased the possibility of having a kind of EHCP by 9% by age 16. So that's extraordinary, the impact it was having, yet it was dismantled. What does that kind of story tell us about how evidence works in this space, and how can we make sure that the next generation of children, or this generation of children, don't get overridden?
Yeah, I mean, I think those IFS evaluations, I think people working in this space, we know the benefits of support like that, but it's really, really helpful to have that hard evidence to be able to say, look, these are the benefits, to the child and the young person, but also to the economy, which can often nab the ear of government better than anything else. But I think having that evidence to show is really, really beneficial, especially as we have a government who's more open to sort of interventions like that. I think in terms of how it was completely dismantled from 2010, it just goes to show, and it's something we've recommended on our report on Best Start family hubs. We've called for government to consider putting Best Start family hubs into law. So essentially, the next government that comes along can't just take away that support for children and families. And I think not just for, having longer term funding, giving local authorities the chance to do long-term planning for that support, but for children and families in communities, for parents who are looking for that support, having that support for the long term in your community, so you can see it, you become familiar with it, and not being worried that at the end of the next funding cycle it's going to be completely dismantled and you'll have nothing left, I think is really important. So I think for us, embedding some of that support into legislation so it can't be dismantled in the way it was, in the way that Sure Start was, is really important.
And these things take such a long time, don't they? And it's, we know that people that work in this space understand the impact, they understand the outcomes. It's how we can best kind of articulate them. So I couldn't agree more with what you said. And also interested, you picked up on, your own report around the Best Start family hubs and the principles by which you want those hubs to work. So you've got, a single front door, family voices being heard, having them embedded within communities and easy to reach, as well as kind of high quality and with school partnerships. And again, we try and emulate a lot of that at Baby Zone. I guess, when you're looking at what's working on the ground, what are the common ingredients you've seen in terms of a successful family hub? What is it that you'd like to see in all of them as the government continues to roll them out across the country?
Yeah, so there's a couple of things, and as they roll out these new ones, the hope is that they don't just run roughshed over all the great practice that is happening out there. I think some of the key things, and I know there's constantly a discussion about co-locating services. So a parent can go to the stay and play service, but then can drop in on a health visitor or a health professional, and I think there is definitely a lot of benefit in that, and it helps with that sort of joined up one single front door approach. But I think, and this will be for in the sort of backgrounds, less so for the parents, but that join up in terms of data, and it's quite a boring point, but I think joining up between schools, early years settings, children's services and health will it will stop families having to turn up at every different service and say, this is my story, and then go to another service and say, this is my story again. It gives them that sort of seamless transition between services, of which family hubs are such a core part in the middle. But and it's not to say that a hub is just a hub. I think another key part of Best Start Family Hubs is having those sort of spokes out into the community, and connections with the early years settings. We know that in England, the majority of early years settings are sort of PVI settings, and so it's slightly harder to sort of ensure that the quality and the early years curriculum, etc., is being taught in a way that joins up with the rest of the sort of education system. So I think building those relationships into the community not only helps reach children and families, but ensures a sort of consistent amount of support for every child, no matter where they're asking for support or what support they're asking for.
And we find that in order to get to those families that are hardest to reach, we operate a barrierless approach. So Baby Zone, parent is only asked for their first name and their postcode when they arrive, and we fully kind of adhere to a universal model and a universal approach to supporting families. And I guess it's in part of the mix that you'd look for with great family hubs and great provision in this space. What are the other kind of key ingredients or other things that you'd look for from a policy perspective of the government to be saying to local authorities or other organisations that are running these facilities, running these support services? What do you want to see them doing? How do you want to see them operating? Yeah,
so I think the government has been, they've said that they want to be, their focus is home learning environment and parenting support, which are really great. We know those are two things that really make a difference. I think for what's delivered from a hub, I think that some of those universal activities, stay and play, parent-infant relationship support type things are really important. We know that it's important not just for the families accessing it, but it removes the sort of stigma that can often sit around family hubs and accessing family help or local services. And we also know that mixing up some of those services together, so putting a health professional in with a stay and play, it's it just makes it more of I think it becomes less daunting to the parents who are visiting. And I went to see Baby Zone, I think the White City Baby Zone.
Okay, yeah.
And so really got a good sense of and I think a lot of that, just the atmosphere, all the different, activities that were going on, I think having that, a welcoming atmosphere, it sounds really simple, but a welcoming place that someone who, might not know anyone in the community, might be new, might have never accessed support, I think is really, really important.
Yeah, we hear so much about postnatal isolation and mums in particular struggling to find friends in the community post-pandemic and really re-engaging them with other people that are going through the same thing. Again, a repeated question we get is about children's development. Is my child on track? Are we doing the right thing? And it's a universal concern around, they're feeding properly. Is there a, mental health challenge that you might be facing? And I guess all of these questions straddle both health and early years as well. And I know that in your report, you've also called for greater unity, greater kind of communication between the Department for Health and the DFE in terms of the investment in family hubs. Why do you think health is so crucial and critical to make this all work?
I mean, I think before that, in that 0 to 2 space in particular, the role of health professionals, even preconception, is so important. And as you say, there's so much information out there for expectant mothers or for new mothers or new parents, that having that sort of trusted health professional just to even, point you in the direction of some really sound advice or, give you that, these are the things you should be thinking about. This is where you can go for this support, signposting you to, and especially if you have, a baby who's been flagged, might have additional needs. That I think is so important, and that comes before, the child is put into an early year setting. And so that support from 0 to 2, and there's all of that evidence about the importance of that 1001 days and sort of getting it right there, but also, across the 0 to 5 is really, really important. I think having that join up, we see, and especially with this government, there's been a lot of focus from the Department for Education, which has been hugely welcome. Less so from the Department of Health. We know that they've got lots on their plate, but I think having that join up, it trickles down to a local level. We're constantly asking schools to join up with health at a local level. What would be really helpful is to see that sort of, that being, emanated at the top, but also in terms of funding. We know that some of the health services that are delivered in the early years are more on the expensive side. And, it's making it increasingly challenging. We know there's workforce issues in the sort of early years health space. So a bit of renewed long-term investment and ambition from Department of Health on the role of, and that's be something we're looking at in a future report, would be really, really welcome in terms of joining up that workforce at a local level and making it sort of a seamless approach to support.
There you go. Well, if anyone's listening from the Department for Health, they'll hopefully hear that call that you've made today. I've got a few kind of quick fire questions for you, if that's all right. So is there one thing that you think every parent listening, we've spoken a lot about policy and a lot about the government and everything else. What do you think the parent should be thinking about the system, and especially what the system isn't telling them at the moment?
Yeah, I think part of that is you are your child's first teacher. There is support out there, and really you should go and access it. But I think parents these days incredibly busy. We all know that. But I think maximising that time that you spend with your child, even if it's just a bit of time after school or whatever it is really important. But then that's sort of like a precursor to accessing support, I think is really important. So maximising that time that you spend with your child.
And if you could get access to Excel spreadsheet at the Treasury ahead of the next spending review and insert your own line item, what would that line item be and how much would it cost?
That's easy. We called for in our report scaling up of join-up family support. So it would be slightly different now because we've had the commitments around Best Start Family Hubs, but we want a scaled up investment into join-up family support. I think we had called for 1.2 billion for this spending review period in total. So I don't know what that would look like in terms of the document, but also that would be scaled up then to 2.2 billion in year 9. So we're not asking for much, but we are asking for a bit more investment into the new Best Start Family Hubs to make sure they're really impactful.
And we've spoken a lot about the challenges today, because there are a lot of challenges, but there's obviously room for optimism, room for hope. What gives you the most hope when thinking about early years policy at the moment?
I think, to be honest, this government there is a lot of good to be hopeful about. I think that they're sort of starting to understand after decades and decades of, there being a lack of focus on the early years. They seem to be understanding not only the importance of that support 0 to 5, but the long-term benefits that come from that. it seems like the sector has finally been successful in saying, look, if you get it right here, you can unlock potential in this space, in this space, in this space. And I think that has been really welcome and hopefully will continue.
And if there was one myth that you'd like to bust about early years policy or about this space, is there anything in particular?
I think one of the myths I would bust is that Sure Start was less effective because it was sort of taken up by middle class families and so therefore wasn't targeting who it should have been targeting, which I think is not the case, and I think we'll see that with Best Start Family Hubs as well.
Brilliant. Thank you so much for joining us. It's really, really important, the work that you're doing and the conversation that you're leading in this space and the influence that you're obviously exerting on the Department for Education, the Treasury and the Department for Health as well. And we welcome all of the reports that you're writing and obviously look forward to seeing future releases in the coming months. And obviously, we hope at Baby Zone to help inform some of the evidence that you're gathering and work with you as you're continuing to see what works and see what we can amplify and spread across the country. So thank you so much for joining me today.
Thank you.
What I'm taking from this conversation is something I think every parent deserves to know. What your child experiences in these first 5 years isn't just about you and them, it's about the decisions made in Whitehall, in local authority budget meetings and in the offices of integrated care boards. The conditions for a child's development are shaped by those policy choices. And those choices have been, for too long, the wrong ones. At Baby Zone, we see every day what happens when families have the right support at the right time, and we see what happens when they don't. The research that Anna and her colleagues are doing, tracking the gaps, naming the failures, building the evidence for what works matters, because it gives all of us the language and the data to demand better. The 75% good level of development target is a start, but as Anna has made clear, getting to 75 means nothing if the 25% who need it most get the least. If you remember one thing from this episode, good policy for the early years isn't a luxury, it's the foundation, and the gap between what we know works and what we actually fund is a choice, and a choice that can be made or unmade. Anna, thank you so much for joining me, and thank you for listening to Best Beginnings, a Baby Zone podcast. For more evidence-informed support on babies and their early years, subscribe to this channel. If you found this helpful, share it with someone you think might need it. We'll see you next time.